Hello, everybody. My name is Paul Heller, and today I'll be speaking briefly on nursing retention and how nursing retention relates to healthcare worldwide and affects many different hospitals and facilities. Introduction. Many times in healthcare, it seems as though healthcare facilities have a difficult time retaining qualified and experienced nurses on different nursing units. So the reason I actually chose this topic is due to a decrease in nursing retention on my unit, which I work, which is 7 West at Lancaster General Hospital, and an increase in new employees being hired there as a result of decreased nurse retention. Since I've been hired there, I was hired on 7 West in February of 2016, and I started night shift right away there. And 2 years into night shift, I actually was the third most senior person on that shift. So we had a huge turnover rate, and as a result, we got a lot of new staff on that unit on night shift. So, in one of the articles that I was reviewing for this assignment, it stated a high nursing turnover rates were where staff members leave a position to take another position in the same facility or completely leave a healthcare facility to work in another or join a different profession is a problem that many countries are currently facing. It's not just the US, but many countries around the world are facing the same issue. So the purpose of this presentation was just created to educate nurses on current literature relating to the topic of nursing retention and how it affects healthcare systems in which they work. This presentation will mostly be dealing with just inpatient nursing. So the research question that I came up for this presentation is by offering career opportunities, additional support staff, recognition of staff achievements, and professional development to nurses in the inpatient setting, will nurse retention increase in healthcare facilities? So the population that we're going to be most focusing on is nurses that work in the inpatient setting. And then our intervention that we'll be introducing for this question is if factors such as career opportunities, increased staff support, recognition of staff achievements, and professional development affect nurse retention rates in inpatient settings. And then we're going to be comparing this to if those things are not offered, what then are nurse retention rates higher if they're offered, or are they lower if they're offered? And the outcome, which I pretty much just kind of stated, if these things are offered at that facility, are your nurses going to stay longer, or is nurse retention not going to be affected by these things? So literature search, I just kind of started my literature search for 5 different sources on Google Scholar. I used a keyword search for nurse retention and nurse turnover rates, and I did find many articles when that first popped up, so I did narrow my search down a little bit by just focusing on the articles that were from 2013 to the present date. And then after looking at several articles, I was able to obtain 2 articles that would work for this project. The other articles that I found I discarded due to several different things. Either they weren't a primary research study or article, or it was not pertaining to nurse retention in the way that I was looking at it, or it was focusing on nurse retention in facilities other than inpatient hospitals. Like I said before, this is just going to mostly look at inpatient setting. I did find a couple articles on nurse retention in outpatient setting as well as home health. I also found some articles referring to retention of like PTCAs or unlicensed personnel in the hospital setting. So those articles kind of got tossed, and these ones will just be focusing on inpatient nurse retention. And then after I got those 2 sources, I went to PA College's library website for the rest of my journal articles. And once again, I just used the same keywords in my search, nursing retention and nurse turnover rates, to find these articles. So then I was able to find the remaining 3 articles on the database through PA College library website. While on the database, I just once again focused on articles published after the year 2013 to the present. And then I did find many articles that were a review of literature and some secondary studies, so I had to toss them. And then I was able to find the 5 articles after I went on PA College's website. And then first thing, they all looked at nurse retention in the inpatient setting. That's mostly what I was looking for. And then it also looked at factors used by different facilities to increase nurse retention. So it looked at different things that different facilities were trying and experimenting on to help increase their nurse retention and have less turnover. And then through the process, I reviewed many different articles about nursing retention and nurse turnover rates. When I first was on Google Scholar, I did get a little frustrated with the number of articles that I found that I was unable to use because they didn't meet the requirements, or it was just an abstract, or that didn't give me the whole article. But after I was able to go to a different database through the college's website, I did find all the articles that I needed after looking through quite a few of the many different articles. So literature synthesis, so kind of comparing and contrasting what each article said regarding nurse retention and nurse turnover rates, and kind of comparing and contrasting them. So what was working for some people and what was not working for other people. So first article by Gantz looked at a couple different things. First off, this article was conducted in Israel, or the experiment was conducted in Israel. And the second one by Dawson was actually conducted in Australia. And then the last three were conducted here in the U.S. So it just goes to show that nurse retention and nurse turnover is a worldwide problem. It's not just a problem here in the U.S. So the first one by Gantz looked at factors that contribute to high nurse turnover rates. Like I said, it's an international problem. And then it also looked at practice environments and job satisfaction. So how work environments related to job satisfaction, so there was a decrease in job satisfaction if the practice environment was bad. So if there was low staffing, high patient to nurse ratios, not a lot of support from either nurse managers or other nursing staff, at that point job satisfaction was low. And if job satisfaction was low, then study pretty much came up with, if your job satisfaction is low, you're going to have a high nurse turnover rate. So if job satisfaction is high, you will have a low nurse turnover rate, and if job satisfaction is low, you'll have a high nurse turnover rate. So that's pretty much what that one said. Dawson then, that article, like I said, it was conducted in Australia, and it just looked at nursing turnover, and it said it was influenced by the experience of the nurse. So whether or not that nurse thought his or her experience at that healthcare facility was a positive one. And some of the factors it looked at was if there was a limited career opportunity, poor staff support, poor recognition, or poor staff attitudes, poor work environment, or poor, some of the things that contributed to a poor work environment was like poor skill mix in the nurses, poor patient ratios, constant change. Some of these things added to poor nurse retention. So if the nursing experience was good, for many things, many things that contributed to this was high nurse staffing or adequate nurse staffing. If the facility offered career opportunities or career advancement or even professional development, things like that, that encouraged nurses to stay with that facility and therefore had an increase in nurse retention and a decrease in nurse turnover rates. One thing that I thought was interesting with this study, and it was most of the other studies as well, money was not necessarily a big thing that contributed to nurse retention. It was more the experience that the nurse had with that facility that was bigger in nurse retention than the money that he or she was getting paid for their services. So that was really what that one was about. And then Budjitsky, that study that was conducted here in the U.S., looked at 12 factors relating to nurse retention. Nursing turnover was affected. It found that nursing turnover was affected a lot by the manager's ability to engage with employees. Employees feel that they are present on the nursing unit. So it used a 12 step survey or questionnaire, I guess you would say, or 12 question questionnaire for collecting data on these nurses. And it found that a lot of what the nurse manager was doing was contributing to the nursing retention on that unit. So if the nurse manager was engaging with the employees and the employees felt that the manager was present on the unit actively, working and participating with staff, those nurse retention rates were higher than if the nurse manager was kind of off, not really engaging with staff. That if that was the case, they found that nursing retention was low and turnover rate was high. And then the next article, Vardaman looked at job embeddedness and change related to self efficiency. So what this kind of looked at was job embeddedness is kind of a term they used that states like if employees become attached to their job, it would be a sacrifice for them to leave. Instead of them wanting to leave, they would be hesitant to leave because they had it good there. So if you have high job embeddedness, the nurse may not want to leave that unit. And then also the change-related self-efficiency. If there's a lot of change on the unit, healthcare is constantly changing, that will lead to higher nurse turnover rates and less nurse retention rates. So if you have high change, your job embeddedness will probably most likely be lower, and then therefore you're going to have a higher turnover rate. So that's a lot of what that study was looking at. And all of the studies kind of said the same thing, with that change is something that drives people away from an institution. And then the last journal article was Hobson. It too looked at job embeddedness, and it was leading to increase in nurse retention ratios. So like I stated before about the article previous to this one, if you have a high job embeddedness or you have people that have been in the organization for a while and it's a sacrifice for them to leave, they're going to stay in that organization longer, and then therefore you're going to have higher nurse retention rates in that institution. So practice or management recommendations. So improving workplace environment is a big thing for retaining staff. If you have a positive workplace environment, if you have an environment that is well staffed and staff feels that they are adequately cared for and their concerns are being heard and something is being done about that, you're going to have a high nurse retention rate. Other things that improve the workplace environment could be, career opportunities within a facility or a professional development, and nurse recognition. I know at Lancaster General we have like the Daisy Award that you can win if you're a nurse. Things like that will lead to higher nurse retention. And then job embeddedness. If you have things that are going to lead to higher nurse retention, you're going to have those people that become embedded in that company or organization and do not leave, and they will be there for long periods of time, and that is just going to increase that's just going to increase the nurse retention rate of that facility. So the picture I have below, just kind of some things that make people go and then other things that make people stay. So hard mental and physical labor, crazy hours, short staffing, and underappreciated are definitely going to be things that cause people to leave. And then on the right, you can see what's going to make people stay: job opportunity, career stepping stone, and caring about patients. So nurse retention is a problem for healthcare facilities worldwide. It continues to rise, or it contributes to healthcare rising costs. Several factors contribute to nurse retention and turnover rates, and then common themes for increasing nurse retention include better staff support, knowledge of staff accomplishments, decrease in changing in the workplace, and professional development. resources.